Bismillah ar-Rahman ar-Rahim. Anaphylaxis. Anaphylaxis is a life-threatening medical emergency. You should call for help and follow and doing ABC approach. Causes of anaphylaxis. Anaphylaxis is type 1 hypersensitivity reaction to allergen, which is IgE mediated type. Histamine release causes the clinical syndrome, and the typical allergens include bee or rasp sting, peanuts, fish, drugs, foods, latex, and contrast media, anesthetic agents. Presentation of anaphylaxis, typically a rapid onset of symptoms of varying severity and include urticaria, angioedema, dyspnea, wheezes, stridor, hypotension, arrhythmia, also rhinitis, abdominal pain, vomiting, diarrhea, and sense of impending doom. Symptoms typically resolve within minutes to hours. It's not clear what determines severity of anaphylaxis in individuals. Asthma and cardiovascular disease are important comorbidities that carry a worse prognosis in anaphylaxis. Patients may have had previous episodes of severe allergic type reactions, usually needs in hospital observation for 6 to 12 hours and sometimes longer. Biphasic anaphylaxis is a further episode, typically within 10 hours after the initial anaphylaxis seems to have resolved without further allergen exposure. And protracted anaphylaxis lasts for hours or days. Management of anaphylaxis includes removal of the allergen where possible, and if there is need for resuscitation, so cardiopulmonary resuscitation should start immediately. Airway and breathing protection and giving oxygen. High flow measures through non-rebreathe mask, aiming for saturation of 94 to 98%. Adrenaline intramuscular should be given, and we can repeat after 5 minutes. Circulation protection by giving fluids such as sodium chloride, boluses, and maintenance doses. Antihistamines such as chlorpheniramine can be given intravenously or intramuscularly, and steroids also can be given. Nebulization of salbutamol and adrenaline if there is bronchospasm, and on discharge, advice on future episodes, medic alert bracelet and card, and to consider intramuscular self-administered adrenaline, and we should refer the patient for allergy and immunology department, and should consider C1 esterase inhibitor deficiency, especially if there is repeated episodes.